Good evening. We are the co-founders of Embrace Race. I'm Melissa Giroux. I'm a multiracial Black-white mom, and I am a life partner of.
Andrew Grant Thomas. I identify as Black or African American, and I'm a dad of the same children Melissa is mom to.
We're in the same house. We're really happy to be here tonight. Embrace Race is a community of support for parents, caregivers, educators, kid-facing professionals who want support and community to help them raise kids who are informed, thoughtful, and brave about race. So we're glad to be with you on Talking Race and Kids, which is a regular webinar series that we have about two a month. And tonight we're excited about this conversation because, folks, COVID is not over. COVID is not over, and it's not affecting us all the same, which we've been talking about since the beginning of COVID with many of you. We're excited tonight to have some researchers on who are looking at the effects of COVID, have sort of surveyed communities of color in particular to look at the physical and mental health effects on communities of color and on kids. And those effects continue, and there'll be sort of a long tail. So we're really glad to be having this important conversation, and Andrew's going to introduce our guests.
And these researchers are also in community, so they're bringing both, wearing both hats in this conversation. The last thing I want to say before introducing them, you'll see at the bottom of your screen, there's a chat box and a Q&A. Please, we have questions from the Q&A from some of you when you registered, but there's also a Q&A box. And we're asking you to use that if you do have questions for our guests, which we'll select from and pose to them in the second half hour of the program. If you put those questions in the chat, we're almost surely not going to see them because it's hard to pull the questions from the comments. But we do encourage you to use the chat and engage each other, share resources, share thoughts, and so on.
And if you're on Facebook, you can put comments you can make comments, and Embrace Racer Tamira is there to answer and relay them to us in Zoom.
Here are our guests whom we're really, really delighted to have. Dr. Ashley Clausen is an assistant professor of psychology at Oklahoma State University and a member of the Center for Pediatric Psychology, the Stevenson Cancer Center, and the Health Promotion Research Center. Dr. Clausen received her PhD in clinical psychology, specializing in pediatric psychology. Dr. Clausen's laboratory, the Child and Family Health Promotion Lab, is a pediatric psychology lab dedicated to promoting health equity for all children and families. Ashley, it's great to have you. We have a second Ashley, Dr. Ashley B. Cole, who is an enrolled tribal member of the Citizen Potawatomi Nation of Oklahoma. Dr. Cole earned her PhD in clinical psychology. She is currently an assistant professor in the Department of Psychology at Oklahoma State and an affiliate of the Health Promotion Research Center and the Stevenson Cancer Center at the University of Oklahoma Health Sciences Center. Dr. Cole's research examines health inequities and health behaviors among American Indian Alaska Native populations. Ashley, welcome. Great to have you. And Kara Wankwo, who is a third-year clinical psychology doctoral student at Oklahoma State University, specializing in pediatric psychology. Kara is a graduate student in the Child and Family Health Promotion Lab and an active leader in the lab's mission to promote health equity and reduce health disparities among kids, families, adolescents, and young adults. Thank you for being here, Kara. Thank you all. We start where we typically do start, which is give us some insight, each of you. And I'll start with you, Ashley Clausen. But give us some insight into what it is about this work, the work we've described. Broadly speaking, what's your personal investment in this? How do you come to this work?
Absolutely. And to get started, I'll note my pronouns are she, her. I'm a cisgendered, heterosexual, white female. That's such a big question. And even though you told me ahead of time, here we go. So I got my PhD in clinical psychology and specializing in pediatric psychology. And that might be new to some. So for us, the specialization is supporting kids who have medical conditions, whether it's asthma or sickle cell disease or cancer or now COVID, et cetera, and supporting their families. And in graduate school, I worked at St. Jude and also attending graduate school in a city that was predominantly Black. And there I was able to see clear health disparities and begin clinical work and collaborating on research with Black families and adolescents. And from there, that's where my passion sort of really, I think, blossomed. And then for the rest of my career, just focused on trying to get more experience in my training with working with BIPOC families, both clinically and in my research. And that's what I do now. Oh, and I have a 2.5-year-old. How could I forget that?
Yeah,
And I'm a partner healthcare provider. There we go.
Thank you, Ashley. And going in alphabetical order, Ashley Cole, tell us a little of your story.
Sure. So first, if it's okay, I'd like to introduce myself in Potawatomi. So bonjour, Mino Gishket, Ashley Cole in Deshnakas. So hello, good evening. My name is Ashley Cole. I'm learning to speak Potawatomi, so thank you for letting me practice that. I'm, as Andrew mentioned, an enrolled member of the Citizen Potawatomi Nation. I was born and raised in Oklahoma, and when I was young, though, my family moved away from our tribal lands. And so I wasn't really connected with my tribe. I didn't grow up traditionally, but we moved back when I was a teenager. So I started kind of reconnecting with my tribe and really forming interests in my graduate work. I did a lot of suicide prevention with tribal populations in Oklahoma. And then since then have just sort of broadened to more general health and health inequities and health behaviors in American Indian and Alaska Native populations. So the project we'll talk about today is both, it's near and dear to my heart, both personally and professionally.
Thank you, Ashley. And Karen.
Yeah, my name is Karen Wonkwo, like you mentioned, and my pronouns are she and her. I am a biracial cisgender female. Growing up, I primarily lived in both Black and white communities. And I remember, I think as early as elementary school, when I started to notice differences between those communities. And in high school, I really started to see how these differences impacted mental health and knew that I wanted to figure out a way to be a part of that solution. And that's when I came to find psychology and specifically pediatric psychology and felt that it was a perfect avenue to kind of use my God-given talents and my passions and really be a part of that change. Another huge component is representation. We know that mental health is still stigmatized in communities of color, and I've been fortunate enough to have many mentors, women of color in psychology, and I just want to be that for the next generation. And I think that that's what drives me to do the work that I do now.
Great. Thank you so much. So, and you all launched a study this past summer, 6 months into COVID, looking at sort of the health status in particular of BIPOC families. And I wonder if you could tell us a bit about that, maybe Ashley Clausen, maybe a little framing. I know you have a slide.
Absolutely. Chris, if you could put up that slide, thank you. So we thought when thinking about this project, as we all were noticing and seeing what was happening with COVID, there were clear disparities that were being shown across racial lines. So in introducing this project, I want to introduce sort of two things that we think about a lot. And one is a social ecological approach to thinking about kids and families and how they're doing. And that just meaning that when thinking about children's mental health, they don't live in vacuums. Kids live within families, and they are in peer systems and school systems and live in different neighborhoods and different states. And for some of us, we live in the United States. So in the research that we did here and that we do with my lab and in collaboration with Dr. Cole's lab, we really try to think systemically and understand what are all the different influences that affect kids and families across these different levels, and understanding that the different systems influence each other. So kids and how they're doing in their mental health, that's going to influence parent mental health. And in the same way, parent mental health is going to influence kids. And that's true in terms of when we think of neighborhoods. What neighborhood you're in is going to impact what schools you're in, and that's going to impact how kids are doing. So we take this multi-level sort of approach to understanding all these influences, and also think about that, kids, we can't take a static picture, right? So we have to understand kids' development across time. So we think about life course and thinking about how early experiences in childhood are going to impact a child's development across time. And also thinking about intergenerational factors that contribute to kid and families' well-being. Thank you, I'll slow down. In terms of intergenerational wealth, but also intergenerational trauma, and how these factors also have to be considered when we're thinking about how are kids and families doing now in COVID. We have to really zoom out and take this broader picture. The next quick concept I wanted to introduce was the one that's on the slide here. And the reason we wanted to talk about it now is because as we learned, yes, there are clear disparities for families. And one approach for intervention is equality. And that being that everyone gets the same intervention, right? Everybody gets a bike. Well, the difficulty with that approach is here we can think, and our goal is optimal health, is when we do an equality approach, some people aren't even able to get on the bike. And otherwise, we see all these barriers where the bike is not meeting people's needs. So no one's really reaching optimal health. So what we'll talk about more is an equity approach where everyone gets a bike, everybody gets support to reach optimal health, but it's really more nuanced and more specific in understanding that all of us have different needs, and we need to support the different needs of kids and families for them to be able to reach optimal health. And on that, Kara will talk about the study more specifically, but that's just sort of in general where we're coming from.
Thank you, Ashley.
Yeah.
So like Dr. Clausen mentioned, we have already had this focus on child and family health, specifically health disparities, fighting for health equity, and we have a specific interest in families with children with asthma. And so prior to the pandemic, we know that generally BIPOC community health outcomes were less than ideal. And this is due to drivers of health or social determinants of health. And these are really the environmental and contextual conditions that influence our physical health and social health and psychological well-being. So these are the conditions where we live, where we work, go to school, where we get healthcare, food, resources, all of that impacts our health. And some families have access to like grade A conditions, and some families don't, and that all affects their health. So I know you all did a webinar earlier in the pandemic, really looking at the rates of COVID within different communities. And we saw pretty early on that the pandemic was affecting communities of color differently, where they were having higher rates of infection and mortality. And we noticed that there was no research specifically focused on understanding how the pandemic was affecting the mental health and the drivers of mental health within these communities. And given our lab's focus in asthma and COVID being a respiratory virus, we also recognize that the pandemic may have especially big impacts on BIPOC families, and especially those families who have children with asthma. And so we decided to launch an online study about a year ago now. So it started June 2020. Where we were really interested in understanding the changes of these social determinants of health. So perceived changes in income, parental employment, food security, mental health, and medical care during COVID-19. And more specifically, we wanted to understand the psychosocial impacts. So is your family worried about getting COVID? Is your family now worried about finances due to COVID? And so we assessed these things across 4 groups. So we had non-Hispanic white parents of children who have asthma and non-Hispanic white parents of children who do not have asthma, and then BIPOC parents of children who have asthma and BIPOC parents of children who do not have asthma. So throughout the course of the study that we ran last summer, we had about over 300 families participate, and Dr. Clausen will talk a little bit more about our results.
Now, I just want to pause just for a moment to underscore the importance of, or one big takeaway from what you've all said, right? And there's sort of the reference to
algo que quiero enfatizar.
the reference to the social ecological model, right, and the reference to social determinants of health, especially because even with respect to COVID, where I think probably the media have done a better job than they typically do, right, bringing attention to these systemic factors, right, these factors outside the control, certainly that beyond behavior. We are a society, as many have noted, that tends to emphasize individual responsibility, right, and individual behavior. So why are some people, some groups more likely, because they're not wearing masks, or because they're just not doing what they're supposed to be doing? And what your work is doing, and again, I'm just repeating what you've said, but just want to underline it because it's so important. It's a huge part of the analysis of so many things that's so often lost. Is you're saying, not that behavior doesn't matter, of course, but that even behavior itself is situated, right, is situated in systems, and that there are non-behavioral factors that affect certainly how groups do. So I just wanted to underline that because it's huge.
And another thing to underline the asthma, looking at asthma in particular, you all had told us that there's an incredible percentage of folks that have asthma, right? Can you give us the stats on that?
Sure, I'm happy to. So overall, asthma is the most common chronic medical condition among kids. Nationally, it's about 7%. But with asthma, we see the same patterns that we see with COVID, and that's that there are clear racial disparities. And a lot of the same social determinants of health that impact COVID risks also impact pediatric asthma, where kids are living. If they're living in housing that has mold or has other exposure to allergens, et cetera, or pollutants, air pollution, exposure to early poverty and crime, these things all work together to put kids at risk for asthma, but also other health conditions. And we see that, for example, some of the highest rates of pediatric asthma we see are among Black youth, Indigenous youth, and Puerto Rican youth.
And I don't want to keep you away from the big results, Ashley Clausen, but can you give us just a feel for a sense of what those numbers are for those especially high risk of asthma, high incidence of asthma populations?
Sure. So it depends whether we're looking at prevalence or incidence, sort of new onset asthma. But if we look at nationally, let's say about 7% of kids, which is not a small number, have asthma. We see higher rates among, let's say, for example, Black youth, and it ranges by study, where it might be 10 to 15%. And then also, again, like I said, it's higher in Indigenous youth and Puerto Rican youth. And something I also want to note is it's not just that kids have asthma and that there's these disparities by whole groups, right? Where Black youth in general are more likely to have asthma than their non-Hispanic white counterparts. But it's also that their asthma outcomes differ, where youth, if they have asthma, they are going to the emergency room more often, or they're having more disease and poor outcomes associated with their asthma, or they're dying from asthma at a higher rate than their white counterparts. So it's not just having it, it's that the outcomes are less good because of the social conditions surrounding being a BIPOC youth in the United States.
So 7% and double that for some groups.
Yeah. And then that will vary by geographic region too.
Right, right. Thank you.
So yeah, Ashley Clausen, if you could tell us a bit of the results for survey.
Sure. As Kara said, and Dr. Cole is going to bring us back with some specific information about Indigenous communities. But for this study, given we already knew that there were disparities in asthma because of these social drivers of health, that is, and then disparities broadly with BIPOC families. That's why we sort of had these 4 groups where we're looking at the intersection of child health, asthma, and their ethnic and racial identity. So for our reference group, we wanted to compare groups, but we kind of needed a reference group. So for us, that was non-Hispanic white families with healthy children, because we conceptualized that for those families, they had the most privilege and likely resource and wouldn't have the stress of having a child with a respiratory condition. So we looked at differences between groups, thinking about that as our comparison group, and social drivers of health, child mental health, and parent mental health. So when we looked at the social drivers of health, what we saw is that our BIPOC families with healthy kids and our BIPOC families with kids with asthma reported that they experienced more discrimination day to day than the non-Hispanic white families with healthy children. And this didn't just occur in their day-to-day life, this happened in healthcare settings. When they were trying to seek medical care, they were being discriminated against. But it didn't end there. What we also saw in our pattern of results is what we conceptualized as a pattern consistent with systemic racism. And that's that for our families, our BIPOC families, those with and without asthma, with the worst pattern being for our BIPOC families with kids with asthma, they let us know that during the pandemic, they had more food insecurity because of the pandemic. They had more income loss because of the pandemic. They were having trouble paying their bills. They were having trouble buying food, and they were having trouble accessing the care that they needed medically. And for us, that's a pattern of systemic racism. And I know we'll talk more about what does this mean, but I can real quick for child mental health. Are kids being affected during the pandemic? Kids are amazingly resilient, but the answer is yes. Yes, they are. Which kids are BIPOC kids, whether they had asthma or not, reported that they're worrying more about their health and their family's health. They're worrying more about their family's loss of income. They're worried more about loss of education. They're worried more about just COVID in general compared to non-Hispanic white healthy children. Now, kids with asthma, non-Hispanic white kids with asthma, they reported some COVID-related distress too, but it was a little different in that they were more generally just worried kind of about COVID, but our BIPOC kids they were worried about COVID, and they were worried about the fact that their family were losing resources, and they were more worried about were they and their family going to be okay. So I think that's an important distinction. And then lastly, how are our parents doing? Our parents were largely incredibly resilient. But some important differences did come up, and that's that our BIPOC families with healthy kids and BIPOC families with kids with asthma, and our non-Hispanic white kids with asthma said that they were very worried about income losses during the pandemic compared to non-Hispanic white families with healthy kids. Why is this important? Because kids live in systems, and if parents are anxious and worried about finances, that's going to have an impact on their own mental health more broadly, but we also know that it affects child mental health. So those are sort of just bullet pointed main, and I'm happy to talk more, but we saw differences in all areas with our BIPOC families with kids with asthma having the worst outcomes.
So part of what I'm hearing, Ashley, is two senses in which these outcomes tend to be sort of systemically linked, right? One is that they are cumulative. So you have, disadvantages and advantages tending to accumulate together. And part of the reason that's true is because they are in fact linked in many cases, right? The same sorts of underlying factors that might cause vulnerability over here are likely to cause it over here as well. And so, right, the same people tend to show the same sort of pattern of outcomes. One thing I wonder, now we have a big question really about both long-term impacts and about solutions, and especially community-based solutions, right? Just so starting for a moment with the long-term effects, a premise, as we noted for this topic and this webinar, was that much of the country is moving on, right? So the vaccines are here. Most adults who want to be vaccinated have been vaccinated at least once, and so on. And for a lot of people and entire communities, it's thank goodness that's over, I can get out again. And obviously that's wonderful for those communities. We know, I think a lot of us appreciate that, appreciate intellectually that some of this impact after 15, 16 months of this country being in crisis, around this pandemic, that some of the effects will be long-term at the societal level. But I suspect that we're less clear on what the long-term impacts will be for people and communities. So you gave us, a list there. I wonder if you can just, what are some of the long-term, meaning the vaccine isn't going to solve, all right, these sorts of problems. 2 years from now, we'll see the residue, if not more than that. Can you give us some idea of what we should be looking out for?
Absolutely. As many amazing scholars, smarter than I am, have said, we are in a syndemic where it's an intersection of the pandemic and racism. And so the pandemic has just widened inequities that are already there. And if we don't do something about it, then these are only going to get wider and lead to even larger disparities between our BIPOC and racially minoritized families and non-Hispanic white families. So if we know that children and caregivers' exposure to discrimination has long-term impacts on mental and physical health, and it's gotten worse during the pandemic. If we don't do something, those impacts are going to be even worse. If we don't do something about the fact that certain families are being exposed to higher stress because of income loss, higher stress because of loss of social support, and being worried about being able to take care of their families, those things are going to, as we know from other literature, impact child and parent mental health. So though we are at a different stage of the pandemic, if we do nothing, these families will falter even more. And these are already families that have been largely prohibited and oppressed. And we have an obligation to stand up now and say things have to be done. I think I loosely answered your question, Andrew, and then I just sort of went this way. So feel free to redirect me.
Sorry, no, that's all good. I'm sure a fuller answer would take more time than we have, I know. I'd love to go, to you, Kara, or Ashley Cole, to give us some sense of what communities are doing in response to it. And, we have a couple of questions, and maybe this would be a natural part of your answer, but we have a couple of questions noting that, yeah, just as the impacts and the effects and sort of the causal chain, the vulnerabilities of different communities are somewhat different, that the solutions surely, I'm sure there are lots of common factors, but also some different ones. So I wonder if, in your answers, you could give us some sense, including with, Ashley Cole, you're doing work on American Indians and Alaska Natives. If there are some particular things, that's already a very diverse group, we know, but if there's some things that you want to highlight that you're aware of on the solution side, that would be wonderful.
Sure, I can speak a little bit to that. So one of the multi-level solutions that has kind of come into play is increased funding and support. So the government has issued several COVID relief bills specific to tribal communities. And so in terms of tribal sovereignty, that those funds get sent to each individual tribe and they decide how to use those funds. And many tribes, I can speak mostly for tribes in Oklahoma, but also tribes across the country have used those funds to support their citizens. So through opening vaccination clinics, through giving additional funds for education, for elder care. A big thing in tribal communities is we don't want to lose our elders, who are some of the knowledge keepers, some of them who know traditional languages. As I introduced myself earlier, sometimes those languages get lost. So really giving increased support sort of across generations and at different levels to help keep community members going. And one thing that I do kind of want to point out, and I'm sort of back channeling a little bit and then coming back, is that American Indian Alaska Natives in particular were at greater risk, depending on the numbers you see, but anywhere from 1 to 3 to 4 times higher rates of contracting COVID, being hospitalized for more severe symptoms related to COVID, and also mortality. And so sort of thinking about in the community level, really tribes, a lot of them are leading the way in vaccinations and taking care of their tribal members, and not just specific to tribal members. A lot of the tribal communities and healthcare organizations have opened up vaccination clinics to all community members, regardless of tribal enrollment status. So I think those are just a few examples, and kind of thinking about the syndemic that Dr. Clausen mentioned, where a lot of tribal communities initially received fewer resources, less PPE, less funding. Tribal members were contracting rates of COVID at higher rates, and then kind of turn that around, where we see the CDC recently released a graphic showing the vaccination rates across ethnicity and race, and American Indian Alaska Natives have the highest rate of vaccinations so far. So I think we can kind of use this also as an opportunity to learn from what our community is doing, who maybe don't have that individual mindset, who have more of that communal mindset. Let's take care of each other. So I feel like I did what Dr. Clausen did, or said she did. I kind of went derailed. I'm sorry if I didn't answer your question, Andrew.
No, that was good. Let me ask just one follow-up, Ashley Cole, which is, I'm thinking about the distinction, the kind of solutions and circumstances of people on tribal territories, right? And at least physical territories versus, members of tribal nations who are not, or people who may be unenrolled for that matter, but aren't, in tribal territories. Do we know anything, even in those big, rough categories, about the distinction and how people are doing?
Yeah, that's a good question. That's I actually saw an article that came out today that said that we really don't know a lot, because it's an issue in terms of, if you're a tribal citizen, where you get healthcare. So you might go get healthcare at Indian Healthcare Services, IHS. You might receive healthcare from a tribal clinic. There's urban tribal clinics, or you might have insurance and receive healthcare from a hospital. There's concerns in terms of the data. Like we're not really sure. It's hard to track, essentially, where folks are getting healthcare, and especially if they're, for example, they might have a specific condition. They might have asthma, where they need to go see a specialist, and then they're referred out of the tribal healthcare system. So it's hard to track, and that's a good point though, Andrew, it is gonna vary by geographic location, and if someone lives in close proximity or lives on a reservation near a healthcare facility versus how far away they are, if they're further away.
Yeah, I'm thinking about how early on, when we started tracking or not tracking race ethnicity data, for example, in the States, and there's still huge gaps in what we know by race ethnicity, and that was true for so long. And that's 50 states, right, who are doing it differently in a hodgepodge of ways, right? Over 500 tribal nations that the U.S. government recognized. I just can't imagine, right? And many of them are really under-resourced. Yeah, the state of the data must be really, really challenging. Kara, what's your thinking? What can you tell us?
So we are talking a lot about these multi-level influences, and so it makes sense that the solutions or the interventions will also be multi-level. So there's a lot of information that we looked at. There's a lot of things going on to address, but I wanted to focus in on mental health, specifically child mental health of Black youth. And so when we're looking at this, taking it from the societal standpoint, are there universal laws that are in place and policies to continuously fund community mental health centers? Are there universal mental health screenings in schools and in doctors' offices, really trying to meet families where they're at? Are we critically looking at the laws that are already in place that are discriminatory, and how can we change those to be more equitable for all people? And then at the community level, what supports are already available in your community? Are there funding for community mental health programs, funding for school-based psychological services, again, wanting to meet families where they're at? Is there a school psychologist that can pull a kiddo aside and do some brief intervention if they're noticing that they're struggling with something? And then taking it a step further in to the family level. Parents and many adults on this call, I'm sure we all have people, young people that are in our lives, whether it be kids or family members that we have influence over. Are we doing mental health check-ins with them? Are mental health conversations a regular part of your household and a norm in your household? Especially for Black and Brown children, are you having conversations with them about their identity, about their racial identity, about what that looks like living here in America? Those types of conversations are known to help foster self-esteem and a sense of pride in who they are, which is linked to positive mental health outcomes. Kids generally learn through observation. And so as an adult in the household, are you setting a good example of self-care? Are you engaging in family value-based activities, whether that be family meal times or physical activity, going to the park, seeking social and tangible support from your other family members and community family members? Again, we know that social support is super big and important in Black and Brown communities and is linked to improved outcomes. And then on the personal level, thinking about the kids, are they engaging in their own value-based activities? We know that things are beginning to open up a little bit more. Are they hanging out with their friends, either virtually or in person, whichever way is safe for them? Are they engaging in their own things that bring them joy? Are they learning ways to check in with their own mental health and kind of noticing changes in that? And if they are, do they have people around them that they feel comfortable reaching out to for support? Do they have access to mental health mobile applications or books, or even engaging in therapy? These are just some of the ideas that we've come up with to support child mental health at the different levels. And we put together this graphic that is huge with lots of recommendations across all levels for a lot of the findings that we found in our paper. And we're not going to show that today, but we will link it either where this Embrace Race webinar will be or on our lab website. This is just a little snippet of what a multi-level intervention may look like to support child mental health.
Thank you so much. Yeah, you guys definitely prepared some great resources that we can pass on to folks where we post this video on at embracerace.org. So we have a lot of questions. So we're going to start on some of those. This one was actually in the chat, but is sort of interesting. And I wonder if this is something that you're seeing a lot of. Someone says, my Black Indigenous grandchild, whose family is working class and who attends a majority white middle upper class school, demonstrated a higher preoccupation with following COVID rules than her white counterparts and other middle class children. The school did not directly attend to that. So that's just a thing I wonder. I mean, that's a thing that we saw as well, just even in our own family, right? Just kids BIPOC kids who maybe have more, who don't feel invulnerable, right? Who might have more experience with other members of the community falling ill to COVID or to other things, right? Might just feel a little bit, we were seeing this, and I'm sure there's other reactions as well, but I wonder whether that's something that came up in the study.
It absolutely was, and that kids were sort of in general reporting more distress and worry about COVID, but also at higher rates than the white kids. They were specifically worried about the health of their family. They were specifically worried about whether they would have enough money and food. So I think kids are definitely more aware and hear what's going on. And from our study and what this caregiver said, yes, they noticed. They notice, and they're hearing my community, my family is more at risk, and are worried about additional things that indeed do contribute to health in their own right.
Now I'm thinking about this question is my spin on a couple of questions that we're getting, and I'm thinking about, so you're training in pediatric psychology, and I'm thinking about what we've learned about and the increasing integration of what we know about adverse childhood experiences, right, into practice, medical practice, including very much with pediatricians and the long-term effects, right, of those adverse experiences in many cases, and also about people talking about, oh, the kids who were sort of came of age during 9/11 or during the Reagan years or during Vietnam, right, or during the Great Depression, right? These are major events that shape the life, the sort of mental apparatus of entire generations. So in a way, this is a revisit to the question of long-term impact, but from your perches as platforms, as pediatric psychologists, are we going to see a generational impact for kids of a certain age of having gone through this?
I'm doing a stare down with Kara. Kara, would you like to take a stab?
Sure. I think that I can't speak to say for sure, but I definitely think that there are going to be some long-term effects for kids, but we do know that kids are resilient. We know that there are things that we've found in research, whether it be mentorship or community resources that can really change the trajectory of these impacts or the negative trajectory of what's going on. So I think that yes, things could be bad, but also we have the knowledge and the resources to change that. It just needs to be kind of put into place.
Let me ask a quick follow-up on that, and wonder if there might actually be some positive impacts with respect to empathy, for example, right? So one thing that was very unusual about this is, although, as we've all stressed, the impacts are very different, by race, class, geography, all sorts of things, still it's hard to think of something else that's happened in this country that's affected people in some meaningful way as widely as this one. Might that mean, and a lot of people being home and being so broadly affected means that I think a lot more people are aware, for example, of the differential racial impacts of this than would have known even about the recession of 2008 and 9, for example.
Or the response to George Floyd, right?
So the response to George Floyd, so I wonder, is it plausible to think that there might be some kids of relative privilege, whatever their racial identity, who might actually have some greater awareness now than they would otherwise have had about the racial and class impacts of something like this? I'm looking for a silver lining.
And Dr. Cole, I'll pull you in too, because we already heard about some resilience. I think I absolutely agree with Kara that this is a stressor. There's no way around it. It's been a stressor for all of us and more for some. But I think the importance of resilience and being a turning point, as Kara mentioned, is critical. And that there are not set trajectories, that there's so much and so much space we have to promote that resilience and that silver lining, Andrew, and that hope. And it's us taking action at all the levels that Kara talked about, critically evaluating and saying, these are the racist policies, creating anti-racist policies and supports across the board in communities at our national level. But there's also this incredible thing that's just called ordinary magic. This is, again, by someone not smarter than, or that is smarter than me. I didn't come up with it. But it's small things we can do that support resilience in kids who've been exposed to extreme stressors such as child abuse and neglect. And that with these supports, with having warm, adult, loving relationships in their life, with having people show them that they care, giving them the space to talk, that those things make huge differences in the trajectories of kids. So I think we need to, now is the time to take action. And I think that hopefully this prompts more of us to take responsibility and action to make changes across all system levels, but also know that we can do small things for all the kids in our lives to show them that we care, we see them, we care, and just being there to be that warm, supportive person. And these small things add up for kids. And we know that these small things make a difference to help kids be resilient in the face of all kind of stressors. But it's our responsibility,
right?
Not theirs.
Right. We have a question. There are also major differences in the numbers of people getting COVID vaccines by race and ethnicity, as was mentioned. What relationship might you see, if any, between access to and or willingness to getting a vaccine and mental health in different communities? How does access or willingness? Yeah, I'm sorry. Go ahead, Ashley.
I was just gonna say, I think, that definitely plays a role, and I think taking into context historical experiences. So there have been documented many examples of, racism and terrible care by medical professionals and researchers to certain communities of color. So I think just having that in mind, in terms of like medical mistrust and how that might contribute to some people's, particularly individuals who identify as BIPOC, it might contribute to their hesitancy about getting the vaccine or about really sort of questioning the medical information that's coming out. So I think that probably plays a role. And I've also sort of on the flip side of that seen some really amazing public health campaigns by, for example, Indigenous doctors, Black physicians, who have said, like, these are the reasons I'm getting the vaccine and here's why. And so really trying to shift that narrative. But I do think that historical mistrust is something to keep in mind, and it's an important consideration.
Thank you, Ashley. Here's another question. The new CDC guidelines regarding masks seem to completely invisibilize small and elementary children who are not vaccinated, and so, of course, BIPOC children. BIPOC, just in case anyone is not clear on the term, Black, Indigenous children, and children of color, in this case. The National Nurses United urges the CDC to revise its dangerous guidelines, quote unquote. Can you speak to how this is going to impact poor and working class BIPOC communities?
We're certainly getting that question in from lots of people, right? Just a real fear, like, what about our kids? Yeah.
About the mask. I can fully appreciate that. So the question being, could this, the new CDC mask guidance have particular harmful or maybe unintended consequences for BIPOC communities and children? I think the answer has to be yes, because I think there are still inequities that are making it where not all communities have the same access to vaccines. Kids in general, they're not eligible to vaccines, but if the adults in the community don't have access to the vaccines, then more adults in the community are at risk for being infected with the virus. So I think for some communities, this takes away a level of protection without having the resources, or if I may go back to my diagram, the right bike to support optimal health for that community. And it's assuming that one policy is going to be a good fit for promoting health in all communities, but that's not what we've seen. And therefore, I don't see any reason why this would be different, that we're trying to do a one size fits all. And I don't think that is going to be likely to support optimal health for our BIPOC communities. Dr. Cole, Kara?
It makes me think of some of the reasons that we kind of discussed a little bit earlier, but some of the social determinants of health of why BIPOC individuals, adults in particular, are at more risk for getting COVID. So a big piece of that is employment, where they're employed as potentially, overly employed as essential workers in places like healthcare facilities, grocery stores, public transportation. So interacting with a lot of people and then thinking about, like their kids at home, how does that affect them? And that's not the same level of protection as someone who can fully work from home or work remotely and stay home with them. And so, yeah, I think I agree with Dr. Clausen that one size kind of fits all policy is probably going to have some negative impacts down the road. And it's hard to know exactly what those will be, but it seems likely.
So we have a question. You've hit on this a bit, but how can we best support ourselves and our children through this time? The more love, the better. How can we best love ourselves and our children? Thank you very much. So I wonder if there are, even yourselves personally, or in what you see other people doing, there are sort of self-care strategies for families that you can recommend in addition to what you've already said. Or what do you do? Is it a family playlist? Is it?
Sure.
Yeah.
I can jump in, and I will say what we also did is we did work on an action guide that provides lots of resources for parents, for healthcare providers, for educators, that talks about, we give lots of resources for evidence-based or screeners that we research tells us work, where you can do screeners of assessing your own mental health, or if you're worried about your children, screeners for assessing mental health. Lists of apps for how do you find out about which therapies work, how do I find a therapist, and other resources, how to do anti-racist training, all these kind of different things. But coming back to your other question, what do? We take it day by day. I think we try to give ourselves grace, as some days are better than others. I think we do a lot of value-based activities in terms of things that are important to us and our North Star. We really enjoy being outside, spending time together, giving social support and seeking it is very important for us. I think a big thing, and Kara mentioned this, is knowing that there are self-help resources out there that we can talk about. Melissa knows this, I'm a huge proponent for acceptance and commitment therapy. There's self-help books out there on that. And there's also, you can do therapy for your child or your family if you're concerned. And I do acceptance and commitment therapy strategies on myself. My husband and I downloaded the book and we do it together. There's specific stuff for acceptance and commitment therapy as it relates to parenting. And I think for everybody, it's different. And for community strengths, I think that's another thing that is a big part for many of us. Kara and Dr. Cole, did you want to elaborate?
I just wanted to add, in addition to all of those things that Dr. Clausen just talked about, I do that, but I also started going to my own therapist during this time. I realized that it was a tough time for me being a Black woman and living in Oklahoma with the pandemic and all the racism and everything going on in the media and in America, and really noticed that I needed some extra support. And I think that it's important for me to be open about this because, like I mentioned earlier, it's very stigmatized in my community, being a Black woman and also being a Nigerian American woman, even more so stigmatized within that community. And I think that the more people that can be open about it if they're comfortable, to help encourage that it's okay if you need some additional help. It's okay if you want to see somebody and talk about what's going on because it's tough. It's been a rough 15, 16 months for everybody. And there are people out there that are there to support you through that. And so that's one way that I've been engaging in self-care during this time.
Now, Carol, let me, we're just at time, but I wanted to squeeze in one more question actually for you. I'm thinking about, especially in light of what you just said, which we really appreciate. Yeah, I mean, we know
with therapy for ourselves, our family system. Yeah.
And we know that, as you said, there is in many communities such stigma against getting mental health support. I also know that you do some of your work. I think you do some volunteering and other things in clinical settings. I'm not remembering if you do it in mental health settings, but I know that you have, you're very much in proximity to community members, frontline folks who are working with community. And I wonder, have you seen, is there a loosening and easing of some of the stigma against mental health support in light of what we've seen and the demands on people?
I think so. I like to think that this is outside of my little bubble, but I do think that the stigma across different communities of color is becoming less for getting mental health treatment and support. It's becoming much more normalized. And I think with the increase of people of color in this field in clinical work and clinical settings and in research has really helped with that. I've had clients say, I was relieved when I saw a person of color was going to be my therapist, and that those messages to me are just so important because I know that by me doing the work that I'm doing, it's helping other people and making them feel a little bit more comfortable. Oh, she looks like me, or she might understand things a little bit differently. And so I'm hoping that as we continue to increase representation within this field, it's just going to become less stigmatized.
Mm-hmm. Thank you so much.
Yeah, I just have to say, you mentioned being Nigerian American. Some folks will know that Nigerian Americans are the most highly formally educated group of people in this country. And, having known a few peers and folks younger who talk about the pressure of achieving and how one is to achieve. Not to say, of course, that everyone in the Nigerian American community follows the same sort of strictures in this way, but we're so glad to have had you here. Kara will be rooting for all of you, and certainly Kara, as you finish your doctoral program and yes, go on to mentor, help mentor, and do the research for that next generation.
Yeah,
you rule. Thank you all.
I'm so proud that we managed to say Ashley Cole and Ashley Clausen.
Ashley Cole, Ashley Clausen.
Going Ashley, or Ashley. We did it. We did it.
The Ashleys is a band.
Yeah. Kara and the Ashleys. Anyway.
Ashleys and the Kara?
Yeah.
Thank you so much for doing this work. Not only the survey, but for all that you're all doing. That's an immense contribution. Thank you. And for spending some time and sharing your insights and wisdom with us.
Everyone who's out there, we will be sending the recording tomorrow. Some of the other resources will come a little later, including the transcript, these amazing action guides and resources that these folks have put together for you. So look forward to that.
Thanks, everyone. Thank you, Chris. Thank you, our wonderful interpreters.
Yeah.
Till we meet again.